Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
All right, folks, we are men and women of our word here, and as promised, Dr. Jitka Lom from Express Care joins us once again. Doctor, welcome back to the program. We're so happy to have you as always.
Thank you.
Okay, and tonight we're talking about something that's very, very delicate to men and women. We're talking about PMS. So it's an acronym that everybody's heard. Some people say it's a very dangerous thing, you know, depending on your perspective and everything like that. So from a woman's perspective, I will let, you know, the stage is yours and everything, medically speaking, and in terms of becoming from a woman, what is PMS?
Okay, PMS is premenstrual syndrome. It's a collection of symptoms that only happens in the second half of the cycle. We measure the menstrual cycle from the first day of bleeding to the next first day of bleeding. And in the second half, which is usually the last 2 weeks of the cycle, many women, about 30% of women, will experience unpleasant symptoms. The most common symptom they experience is fatigue, great sense of low energy, tired, and bloating. And then there are many other symptoms that go along with it, such as headaches and trouble sleeping and breast tenderness and diarrhea sometimes and rashes and many, many symptoms of the physical nature. And then what everybody jokes about are the emotional or behavioral symptoms. And some of those are cravings for foods, irritability, anger, depression, not very pleasant symptoms, symptoms of unhappiness during those last 2 weeks.
Yeah, many different women have many different ways of going through it, none of them pleasant.
Right.
Yeah, okay. So is there any treatment for PMS? I guess that's the most obvious question.
Yeah, there is. First of all, recognizing that that's what it is. You know, keeping a chart of your cycle so that you can know that, okay, coming up for the next couple of weeks, there's going to be some unpleasantness coming down the road. Exercise is super important for sufferers of PMS. Maintaining a low stress situation during those 2 weeks if you can. It's very, very helpful. And then there are medicines that can help women through that time. They tend to be in the antidepressant or anti-anxiety category, and sometimes women will just take them during those 2 weeks. Other times they'll take them all month long to help them for that period of time. But it is treatable, and they don't have to suffer. And it's not really a pleasant thing that they should go through for maybe over 20 years of their lives.
Absolutely. So let me ask on behalf of all of us on planet Earth who carry the XY chromosome, as a man, and what can myself and my fellow men do to better take care of, you know, of women going through PMS, and how can we be more sensitive to what women go through?
That's just so thoughtful and nice. Well, I think just being aware would be very helpful. Not reacting, understanding that your lady is going through a difficult time. You could compare it to having been through jet lag and feeling very uncomfortable, maybe slightly sick. You think of the way that you would feel at that time and how you would like other people to treat you. Maybe allowing her to get a little bit more rest, and not reacting if there's a lot of anger and irritability. Also encouraging her to get help. Now, joking about it tends to backfire.
Yeah, that is definitely not something. I mean, I'm sure there are a lot of guys watching right there that tried to use humor, and it is completely blown up in their face. So.
Yeah.
Okay. Now, on a serious note, you know, throwing humor completely out, are there symptoms that can lean towards the severe, in which case you'd need to see a doctor like yourself?
Yeah, for sure. Sometimes the women have what's a more serious psychiatric disorder called premenstrual dysphoric disorder, and what happens is that their depression and their anxiety during those last 2 weeks of the cycle becomes so severe that they actually really just can't function very well. Paranoid, very fearful, anxious, stressed out, crying, out of control emotions. And no one really understands why this happens 100%, but of course there's a huge hormonal change in the first half of the cycle, the second half of the cycle. You're really looking at a completely different woman in the hormonal picture. So she's completely different, and there's a lot of swelling that occurs, sometimes bloating of the abdomen and even swelling of the legs and hands. And you can imagine that there's also some swelling inside the brain sometimes. And so, some of these women are very, very, very tortured during those 2 weeks, and they really need a medication to help them through.
Okay, well, we do have a bunch of Facebook questions relative to PMS, so we'll get to those when Healthy Living Tuesday continues with Dr. Lom from Express Care right here on KUAM. Stay with us.